Hello and welcome to Vet Med Corner. I'm Dr. M. Today we're going to be talking about pain and specifically pain in cats. It's a big and complicated subject, so we are only going to scratch the surface of it, but join me. I hope you'll learn something today. So pain can be classified into two categories. We have acute pain and we also have chronic pain. Acute pain would be what happens immediately after a surgery or after an injury when you're trying to heal from that injury. And chronic pain would be the result of something like arthritis or after a declaw happens. This is part of why it's illegal in so many countries, including where I practice. Declaws frequently cause a lot of chronic pain for the lifetime of our cats. And so those are the two categories of pain. We will now start talking about signs that cats display when they are in pain. These are generalities and it's a little bit tricky because cats are often more subtle about this than, say, our dogs are, and as a result, cat pain is dramatically undertreated. It is a huge problem. People aren't watching for pain in their cats enough. The other tricky part is that when a cat is in a vet clinic, they're very frequently very still. We don't see them do a lot of moving, and because they are just laying there, often they're a bit nervous, so they kind of are a bit frozen. The veterinarian also doesn't have a very good chance to evaluate if that cat is in pain. It's not like the dog that comes walking in usually on a harness. So it's important that you take video of things that you notice at home and show them to your veterinarian to be like, hey, my cat used to do this jump up or down very easily. Now I notice this hesitation. Now I notice the cat avoiding this jump and going, another route instead. Take video of those sorts of things, bring them to your veterinarian and use those videos as a way to advocate for your cat. The first category that we will discuss would be attitude or mentation, and here we're really looking for a change from what is normal. So a cat that is in pain will often become a bit more withdrawn. Some cats will become defensive and or aggressive, whether to people or to other pets that are in the house. You might also notice a decrease in wanting to play. And we have research in dogs that shows us that when dogs are painful, they very commonly become hypersensitive to noises. And I do clinically see this also in our cats, that they will become hypersensitive to noise, that they might hide more, that they might become a bit more nervous or anxious, people will describe their cats as, and that is frequently a result of pain. We don't have cat-specific research in this area, but it is something to watch out for. It's also a common symptom for cats that are in pain to reduce the amount of grooming that they do. And so one of the first signs, especially for like more subtle chronic pain that we'll notice, is all of a sudden the cat has an unkempt appearance. Their coat just looks a bit rougher than it used to, or if they're longer haired, they might get mats where they used to not get mats. Especially if this is a result of arthritis, they might start getting mats around their back end because they can no longer comfortably reach it to groom, so they don't groom that area as often. So a decrease in coat quality is a sign of pain. It can be a sign of other things, just generally feeling unwell, but many of those things can cause pain that then results in a decrease in grooming. So keep an eye out for that. If you notice that your cat is over grooming an area, one of the first things that needs to be ruled out is pain. We know that arthritis pain and bladder pain are very, very common causes of over-grooming. So you'll need to see your veterinarian, and in addition to ruling out potential skin issues, your veterinarian will also need to do a trial for pain management. This is because cat pain can be very difficult to pick up on, as we discussed already, and the only way to rule out if pain is causing your cat to do this is with a pain medication trial. We also need to be aware that cats in pain will frequently hiss or swat or guard parts of their body that are in pain. So if you usually know that your cat really enjoys, say, being scratched under the chin, and all of a sudden they're pulling away from you or they're swatting at you when you go to do that sort of a thing, this could very well be because of pain, and so it's important to investigate these sorts of behavior changes. For cats, we also need to discuss their posture. A cat that has pain will often look hunkered down in appearance. You know, they'll often be sternal, so laying upright, kind of in a, sometimes people call it a loaf type of position with all the legs tucked under themselves, and they look scrunched and hunched and tense, and they might stay in that position for a long period of time. This is pretty abnormal. Cats that are comfortable will be, you know, nicely laying on, say, one side or in like a croissant type of a shape. That's generally a more comfortable position, where this hunched or tight appearance is more typical of a cat that is uncomfortable. Next, we will discuss vocalizations. Cats that are in pain might meow or cry. However, cats that are in pain will also purr. The theory is that they might be trying to self-soothe, or that the purring vibration, they may be trying to help themselves feel better and heal. It's also important to note that when cats have a wound or an incision, if it's comfortable, they should not flinch if that area is brushed, or they also should, you know, be more or less ignoring that area. If it's painful, they will flinch, or they might groom at the area quite a bit. The biggest area that we need to pay attention to with cats is their facial expressions. Cat expressions are more subtle than human and dog ones. They do have kind of fewer muscles that they control to change the expression of their face, but once you know what you're looking for, it becomes more obvious. Cats that are comfortable will have whiskers forward, eyes open and bright. They will be wanting to engage with their people. Their ears are up. That's a very specific picture. Cats that are in pain will often have slanted, narrowed, or even closed eyes. Their whiskers will be tense and usually tucked back. Their ears will also be tight, and so they might be rotated or tucked back as well. These things are all indications of cats that are in pain, and so it's important to pay attention to those subtle changes and watch for them, and then work with your veterinarian to find the cause of the pain if you're noticing those sorts of issues. We also need to discuss mobility when we're thinking about pain. It is very normal for cats to want and seek out vertical spaces, especially for resting. They feel more comfortable up there. They like to be able to watch their surroundings from above. And so it's important to note that if your cat starts to have more trouble getting up to their spaces, or coming down from them, jumping up, jumping down, both of those situations can be times where your cat might act hesitant or tentative where they otherwise wouldn't. They might try to find an alternative route. They might go up to their preferred spots less often. If you're noticing any of those changes, it's important to bring those up with your veterinarian. Arthritis is incredibly common in our cats, and it's often bilateral, and so that means affecting both sides of the body, and so you won't notice say like one leg limping like you might more commonly see for a dog. And because it is affecting both sides of the body more often, it's harder to catch a change in gait with cats that are painful. It still could be present, absolutely, but an absence of limping definitely doesn't mean that the cat isn't painful. A cat can be in a significant amount of pain and not have a limp if both sides of the body are being affected. You would just notice a slowing down, hesitation to jump up or down. And so it's important that when you notice these things to start modifying the environment for your cat, put more ramps, make jumps smaller and easier for your cat to do, but also make sure that you get pain medication from your veterinarian to treat that pain that your cat has so that they can go back to getting that vertical enrichment that they need. There are also physiological changes that can be noticed with cats that are painful. There can be dilated pupils, although there are many reasons for pupils to dilate. Pain is one of them. You can also notice that their breathing rate will increase. And so if you notice that when your cat is at rest, that their chest is moving faster than it used to, this is something to track and pay attention to and bring up with your veterinarian when you see them. Because assessing pain in cats is a challenge for a lot of people, it is the standard of care to do pain management trials whenever there's a potential for an issue to be caused by pain. This is very important to remember because we don't want to miss underlying pain that causes especially a behavior change or a grooming change, and have you and or your veterinarian just jump to behavior medication. We miss a lot of pain in our cats this way, and so it's important that before behavior medication is started, that a pain management trial is done first. You'll need to give this medication for pain for a number of days to a number of weeks, kind of depending on the issue and the situation that your specific cat is in. So make sure that that's done before moving on to other potential causes. Thank you for watching this video on cats and pain. If you have any questions or there's anything that wasn't clear, please comment below. Ask me. I love to hear your feedback as well. I'd also love to get ideas for things you want for upcoming videos. I do have a goal currently to double the number of subscribers to this channel. So if you aren't subscribed, please do, or share this video to someone you know that has cats and would enjoy the information here. Thank you so much for joining me, and we'll see you on the next one.